Sorry, I look like I'm in like a very strange padded room, but this is the silent booths for meetings at WHO look like this. So super warm welcome to everyone. We're so excited to have you as we officially launch the Catalyst Lab with all of you this morning or this afternoon or this evening. So welcome and such a historic moment for all of us to be together. And this is the phase 2 of work that a few of you were part of in phase 1. And we're so excited that you've come through a lot to be at this phase. Congratulations for those of you who are here. You were selected. You did a lot of work already. You probably feel like you've been in the program for 2 months already as you've refined and developed your projects, had feedback, met with us already. So we're really, really excited to have you with us today. It's a packed session. So I'm going to jump right in and share the screen and start with the introductions. Sorry, I've got many different things open. I'm trying to find which one I want. Give me 1 second. So we'll start with introductions from all of the faculty who are here, because we want you to know all of them. We know that some of you do know them already, but we wanted to just highlight them. Some are not here today. There are, I don't even know how many people on this slide, 18, I think. And so not everyone is here, but many of them are. So I'm just going to give them a chance when I call their name to unmute and say hi. So I'll go starting from Alex Daniels. If you're here, just unmute and wave and say hi.
Thanks, Megan. So my name is Alex Daniels. I'm a nurse. I live in Durban, South Africa, and I work for ICPCN, and it's great to be a new experience and looking forward to it.
Thank you so much. Anu Telly.
Hi everybody, I'm Anu Sabu. I work but I co-lead pediatric palliative care in nursing introductory course in pediatric palliative care nursing course. Looking forward. Thank you all.
Thank you. Archana Iyengar.
Hello, everybody. Thank you for having me here. I'm a pediatric palliative care physician and I take care of the program in Hyderabad. Thank you.
Thank you. Kamara Van Bremen.
Hi, I'm a nurse practitioner. I work in Vancouver, Canada in a hospice, hospital, and home setting. And I've been doing pediatric palliative care for quite a while, and I'm very happy to be here. Thank you.
Daniel Mason.
Hi guys, Dan Mason. I'm a hospice and palliative care physician in the US. I work for a company called Accent Care. I'm delighted to be part of this group. Thanks so much, everybody.
Thank you. Emily Scutaru. Okay, maybe she's not here.
No.
Oh, sorry. Go ahead.
My name is Emily. I am also a nurse practitioner. I work as part of the Quality Care program in Hamilton, Ontario, Canada, and looking forward to joining today.
Thank you, Emily. Gayatri Palat.
I am Gayatri Palat from Hyderabad, a palliative care physician. I'm a consultant to Tools Cancer Collaboration and also one of the board members of ICPCN. Thank you.
Thank you. Isla Duff. Okay, Kritika Rao.
Hello, hi, I'm Kritika Rao. I'm a palliative care physician. I work at Super Medical College, Manipal University Teaching Hospital in Southern India.
Thank you, Kritika. Laura Dale Harris. I think maybe she's not here today. Me, I forgot to introduce myself. I'm Megan Doherty. Very nice to meet you all. And I'm a pediatric palliative care physician and the director of the Sunflower Children's Network with Two Worlds Cancer Collaboration. Mustafa Kamal Chowdhury, Adil.
Hi everyone, this is Dr. Adil from Bangladesh, palliative care physician and working as an associate professor in the Department of Palliative Medicine at Bangladesh Medical University.
Thank you, Dr. Adil. Rima Saad. I think Rima is away today, she told me. Sean Timpani.
Hi, guys. I'm a pediatric palliative care physician in the city of Boise in the United States. I'm new to Two Worlds Cancer Care, but I've been doing pediatric palliative care for quite a while. Excited to be part of things.
Thank you, Sean. Smriti Khanna.
Hi guys, I'm Smriti Khanna. I'm a pediatric and adult palliative care physician based in Mumbai, India. I've been associated with Two Worlds and Sunflower for a few years now. Have been quite a few part of quite a few of their echoes, but new to Catalyst Lab and very excited. Thank you.
Thank you, Smriti. Spandana Raina.
Hello, everyone. I'm Spandana. I'm a pediatric palliative care physician. Very, very excited to be with you all.
Thank you. Teresa Vente.
Hi, everyone. My name is Teresa Venti. I am at Stanford University in California. I'm a pediatric palliative care physician. I'm new to the program and I'm excited to be here.
Thank you. And I know it's very early for you, so thank you so much. And Yadu Ravendran.
Hi, my name is Yadu. Nice to meet you all. I work for St. Jude Global or St. Jude Children's Research Hospital with the St. Jude Global Program. I'm program manager for the South Asia region. So excited to be here. Thanks.
Thank you. Thank you very much. So as you can see, there's a huge group of mentors and supporters. Some additional people who I didn't even introduce on this slide are speakers for some of the sessions, but are not formally faculty mentors. Many of them have been in the past. So you will see even more global leaders in palliative care joining us as we go through our time together over the next 2 years. Now, what we thought we would do is introduce each of the teams.
Megan, can I just interrupt? Yeah. I don't know if Archana introduced herself.
Sorry. Yes, please, Archana, can I ask you to introduce yourself? Because you will be such an integral part of all of the sessions, and you hid by not putting yourself on that slide. So over to you.
Hi, everyone. I'm Archana. I'm come with public health and project management experience and expertise in specifically palliative care. And I'm working as the project leader with Sunflower Children's Network. Thank you. And the person who's going to be spamming you. Yep.
Thank you so much, Archana. So what we know is really valuable is from our experience over the past number of years with the leadership program part 1 was to get to know the other teams and what they're doing. Of course, we don't have time for you to learn all about every project today, but we wanted to give you a chance to just put some faces and names to the other participants in the program, particularly as for this part of the leadership program, we're not having like an in-person workshop at the beginning. Which we had done in previous years. So what we've prepared is one slide for each of the 8 projects. So there's project teams for each of these 8 projects who are in the Catalyst Lab with you. So when I put your slide up, like I've done here for the team that's in Bengaluru, India, I'm just going to ask that each of the participants just unmutes and introduces themselves very quickly, okay? In very, very brief introductions. And if the first person can just say the name of the project, which is listed there, so that we know what your project is a little bit about from its title. So Anuradha.
Yeah. Hi, everybody. So excited to be part of this. I'm a practicing pediatric anesthesiologist and a pediatric palliative care physician. My team member is Dr. Nikhila Karan. Both of us are from Southern India, Bangalore. And we hope to be starting this project, which is called Punash Chetana, which means revival. The infrastructure is there, the physicians are there, the patients are there, and we don't have the the process in place. So I think the whole idea about being part of Catalyst Lab was to revive, and that is why we have named our project as Punash Chetana, which is revival. Thank you.
Thank you. And Nicola, do you want to introduce yourself very briefly?
I'm Dr. Nikhila Karan, the palliative care physician practicing both adult and pediatric palliative care. Happy to be part of this team. Thank you.
Thank you very much. Sorry to rush everybody, but I know how the time will suddenly get away from us. So we have the team from Mumbai. So I'll first call on Ashish, who has been promoted to doctor, I think. Ashish, please correct and tell us about yourself, the project name, and then I'll call on the others.
Hello, I'm audible.
Yes.
Hi, good evening, everybody. My name is Ashish. I'm a senior nurse in charge practicing pediatric palliative care from last 7 years in Baijarbai Wadi Hospital, Mumbai, India. Our project is basically strengthening pediatric palliative care delivered through nursing leadership, a leadership initiative to develop nurses as system builders in pediatric palliative care across India. And in my team, there is Dr. Mansi. She is a doctor, pediatric doctor and palliative physician, and Savio Punachan, who is medical social worker, and presently working as an project coordinator in our hospital in palliative department.
Thank you very much. Mansi and Savio, do you want to briefly unmute and introduce?
Yes, thank you for this opportunity. I'm Mansi and I'm a pediatric palliative physician at Baijar Wadia Hospital for Children. Really excited to be on this program with everyone. Thanks.
Thank you.
Savio?
Yeah, hi. I'm Savio. I'm a social worker, and I'm currently working as a project coordinator for the department. Thank you.
Thank you. Okay, we have the team joining from Sri Lanka. So I'll call first on Dr. Dylan Kani.
I'm Vidya from Sri Lanka, a medical officer in palliative care, working at National Cancer Institute Sri Lanka, where we started pediatric palliative care services for the country. So our plan is to expand these services island-wide, and I'm working with our nursing officer.
Okay, I just missed the last thing you said.
My other team member is Ms. Kanchana.
Perfect. Thank you so much. Kanchana, if you're there, do you want to say hi briefly?
Hi everyone, I'm Kanchana, leading a cancer institute and pelvic cancer sir. I'm very excited and happy to be with this program. Thank you.
Thank you, Kanchana. And I apologize if I say anybody's name wrong. And sometimes I'm just saying one name because I'm confident in the pronunciation of it. So the team from the Philippines, from Manila, I'll call on Dr. Liza first.
Hi. Hi, everyone. Excited to be here. And our team, just to give context to our project, we are 6 years in the making, especially one of the babies of TWCC, because four of the graduates have become practitioners in pediatric palliative care. And we have expanded our services in terms of inpatient, outpatient, and home care. However, what gap we see now is the sustainability of our teams, and it appears that we don't have a formal recognized professional workforce in the Philippines. That's why our project hopefully would allow us to come up with a framework, which is the workforce sustainability in pediatric palliative care, to allow our dedicated team to prosper or thrive in their practice. So I know it's ambitious for us, and I think that's really complementing our 2026 project, which is the first leadership, which is starting the palliative care. And would like to share with you that we're in a few weeks from now, we'll be starting our pre-fellowship program. So that's why we need to make sure that our teams are safe and become sustainable in their practice, because they'll not just be practitioners, they'll also be trainers. So hopefully we'll learn a lot from everyone to ensure that we come up with something that will help our team become more sustainable long term. Thank you.
Thank you, Lisa. So wonderful to hear about sustainability right from the get-go. So we have Maria. Do you want to introduce
Hi,
yourself? Go ahead.
good evening. Good evening, everyone. I am Maria Socorro Vargas. They call me Koi for short. I'm a pediatric palliative care nurse at National Children's Hospital and been working with the team for almost 5 years already.
Thank you, Koi. And Neil Patrick Navarro?
Megan is having challenges, and I think that I echo. Yeah.
Okay. Yeah, I know it's been a bit tricky. There was a number of people who are having some trouble today, unfortunately. So welcome. Okay, so now to the team based in Kathmandu, Nepal. So I'll hand over to Dr. Bishot to tell us very briefly about the project.
Hi, I'm Biswa. I'm actually a pediatric oncologist working at Kranti Children's Hospital, Kathmandu, Nepal. And our project is to pilot and initiate home-based palliative care for sick children in the Kathmandu Valley. Actually, we don't have established setup for this home-based palliative care for children in Nepal. So we are trying to initiate with that.
Perfect. Thank you very much. And over to Dr. Nisha.
Hello, everyone. I'm so glad to see you all again. I'm one of the recipients of the leadership program last year. And I think, as Bishwa said, we have developed quite few number of healthcare workers who are trained in basic palliative uh, care. And we are trying to utilize them for the home-based care for the Kathmandu Valley. So I'm so excited to be here in this project again. Thank you so much. Thank you.
Thank you, Dr. Nisha. And Bandana?
Right.
Everyone, I am Bandana Adhikari, staff nurse from Kanti Children's Hospital. Recently, I am graduated from leadership program, and most of the faces are known for me as well. In this project, I will carry out my role as a coordinator of overall home care team management. Thank you.
Thank you, Bandana. I'm so glad that you're here with us. Okay, over to the team in Varanasi, India. So I'll call on Pallavi Singh as the first one to tell us about the project.
Hello, everyone. Hi. I'm so glad that my project is accepted this year too. Thank you for that. So I'm from Varanasi TMC. This year, I'm focusing more on the adolescent age group population, and my plan is to establish adolescent palliative care clinic. I'm a palliative care physician. I work both in pediatric and adult. I see both patients, so I want to cover both the population and be a bridge in both of them and take care of them. Thank you.
Thank you. And your project partner is Pragya Verma?
Pragya, yes.
Pragya, if you're there and you want to unmute, that'd be wonderful.
Hello everyone, myself Pragya Verma. I am also from Varanasi working with Dr. Pallavi. I am a patient navigator in pediatric palliative care. Happy to join this Catalyst program. This is new for me. So I hope I get lots of learning here. Thank you. As Dr. Pallavi introduced earlier about our project, it's focusing on the quality of life of adolescent age group from covering all the DMGs of oncology patients.
Thank you, Pragya. And we're so glad that you're with us. I hope everyone can see the multidisciplinary teams that are coming together for each of these projects. That's why we've specifically identified the roles that people have, so you get a sense of how the projects are teams are formed. We have the team from Kerala, India, Dr. Hari Prasad. Call on you to give a very brief introduction and mention the project.
So thank you. So very happy to be back again in the team of this global palliative team, and I think after my completing my first session in the global palliative care, we are planning to expand our project to the whole state of Kerala, where we are trying to implement the principles of pediatric palliative care across the state of Kerala through multifaceted mode. That is one, training pediatricians, as well as implementing protocol for procedural pain and selected hospitals across Kerala, as well as training staff nurses who are dealing with the children in these hospitals. So I think with this, we will be able to implement a pediatric palliative care in most of the regions of Kerala. And this will be a role model state for other states of India. Thank you.
Thank you. And I'll call on Manju, the nurse who's on the project with you, if you want to unmute and introduce yourself, Manju.
Hi everyone, this is Manju. I am a pediatric nurse from Kerala government, associating with Dr. Hari Prasad. Glad to be part of this program. Thank you.
Thank you very much. And the team from Palawan, Philippines, we have Dr. Frederick. Could you tell us your project?
Hi, Megan. Maybe I should just
Go ahead,
begin.
yes.
Yeah. So good evening, everyone. I'm Shohara. You can call me Sho. I'm a pediatric palliative care physician in the Philippines. And our project is literally a catalyst project because we are starting this in the island of Palawan. That aims to build a palliative care network within this island. So I am partnering with a very established and respectable leader in the Pediatric Society and also in the Medical Society in Palawan, Dr. Reynaldo Frederick Quicho. Our project is called Malipay Buhi, which means, which is a Cebuano word for joyful living, a catalyst project for pediatric palliative care in Palawan. So may I call on my partner, Dr. Fred?
Thank you,
Hi,
Shohara.
good evening.
Go ahead, Fred.
Hi, good evening. I'm Fred, Dr. Fred Kicho, and I'm partnering with an expert, Dr. Resho, and I'm looking forward to be working with her and also to the rest of the team. Thank you for having us.
Thank you. Perfect. Okay, so that was the 8 teams. We have heard from all of you, and you did very well, I have to say. We kept quite close to time. So we're going to come back to some of this content a little bit later, because I think some of it we'll cover at the end of closer to the end of today's session, regarding expectations, attendance, and dates. And what I want to show you now very briefly is the project portfolio, which will be your best friend and enemy, I'm sure, and talk very briefly about the mentoring. And then what I think we'll do is we'll go into the mentoring groups with your mentors now. I'll explain what you do in the groups, and then we'll come back together and I'll go over some more content after that. So just skip to this section. I'm going to show you, I'm actually going to just stop sharing this and show you the project portfolio on the screen. So you got an email earlier today from Archana showing you the portfolio document. That is, there's a specific one for each of your groups. Okay, there's one document for the whole group. So that link you're going to have here, your project title, your team members, and the names of your mentors. So you should be all aware of all of those things, and you've already been connected to your mentors by email last week. The document has 6 sections, and we have become very good with our Google Docs. So you can just click, and they're on the left here. You can just go to the different sections. I'm going to highlight a few key things that we're going to look at right away today. So the first thing is that you're going to, in the next few weeks, you're going to create this personal leadership action plan. And you can see here that this is supposed to be completed by the end of May. Okay. This is personal, so there'll be one for each person in your group. Okay, so if we click to it, if you have more than 2 team members, there'll be a space for each of them. So here you have the first person's name, and then you're going to go
Megan,
through.
we can see the mentor-mentee part itself. I don't know if it's moving
You're
for
not
others.
seeing the same thing. I am.
Yeah,
Sorry.
yeah.
Thank you for stopping me. Okay, here we go. How's this?
Yeah.
My apologies. I had 2 versions, 2 copies of it open. I'm showing one and moving the other. So yeah, so section 1 here, you can see the due date. And then if you click to, you've got the team member, the name, you'll have your team members, and you'll fill this in individually and reflect on these. It's self-explanatory. I'm not going to go over it today. You're going to be able to just fill it in by yourselves. And then you're going to use this when you talk, you're going to share this with your mentor and you're going to talk about it together, because this is going to say, okay, where am I at right now in this first phase of the first 2 months of the Catalyst Lab? There's some time for sort of personal reflection. Where am I at? What are the things that I really want to learn from this leadership program over the next 2 years? And some of that is, first thinking about your strengths, then thinking about what's most important to you, thinking about a goal that you have for yourself. How are you going to change? We know that you're going to do a change project and you're going to change the system and how palliative care is, but you're also, as an individual, going to be changed and adapt as you go through this program. So all of this is looking at these two things together. Okay. So what I want to highlight is the next thing we're going to do today, which is you're going to have about 20 minutes in your breakout rooms with your mentors. Okay. We're probably going to use the word mentor and mentors interchangeably. Okay. So if we say mentor, we mean all of your mentors together. And same with mentee, that means you, but it also means the other people who are in your team or your group, right? Who are on the slide with you together. Okay. So what we want you to do is to use this template that we've built. Very simple. It's very basic. It's not to cause a lot of work for you. Each time you have a meeting, because we know that you want to remember who came to the meeting, what you talked about, just a very brief summary. And then was there any like action items or things to do next and who's responsible for them? And then there's space for your mentor to make a few comments about strengths or anything to improve upon, and space for other notes. So today we're going to have the first meeting, April 2026, and we've given you some things that we feel that you should discuss in this first meeting today. Okay. I'm going to show them up on a slide, but you're going to introduce yourself. You've all introduced yourself a little bit, but take a little bit more time to get to know each other. We know that that will take a few sessions, and we're not saying that you're going to be able to accomplish all of that in the next 20 minutes because we know we're not giving you a lot of time. So this is a first session for April, but we do encourage you to have a second April session where you have time and you're able to share a bit more. In terms of what you introduce, you may talk a little bit about your experiences and your journey to this point as a leader and in your career. You're going to start to think about what are your goals for the mentor? How do you want them to help you as a team? And really important that you talk about the fact that it's confidential. This is information you're sharing in this small group. It's whatever you guys share as a group, as mentors and mentees, it stays there. It doesn't get shared elsewhere. And really important that you talk about the meeting cadence. Cadence is a fancy word to just say the timing, the frequency, and the best times to schedule a meeting. So figure out what time zone your mentors are in and talk about, okay, based on all of our time zones, like is 5 o'clock in India going to be the best time for us to meet? They might be able to tell you, I prefer certain days of the week, other days I rarely am available. So you start to get to know, because we're expecting the mentees to schedule the meeting. So we want you to get to know what are sort of potential dates for your mentor so you can start to plan the next meeting and schedule it. So these are the topics that we're now going to go into the groups and give you a bit of time to start discussing for the next 20 minutes, and then we'll come back together and we'll bring you back into the main room, and then we will have some didactic teaching on the first topic, which is project design, and a little bit more details about key aspects of the program. So I just want to stop there, make sure it's clear for everybody. No, I've gone over that a bit quickly. Okay, I think we'll go into the mentor-mentee breakout rooms now. Archana, if you want to send us into our rooms.
I have it, Megan. Yeah. Do you want me to do it for 20 minutes?
No, do it for 17 minutes, and then we'll give a 1-minute warning and we'll come back, because by the time we all come back, it's going to take another minute or two.
Yeah, okay. Opening the room.
Okay, welcome back, everybody. Is everybody back? I think so. Okay, great. So we want to cover a little more content, because we actually had a topic for this session that I've prepared a very short didactic on. So we will talk a little bit more about mentor expectations a little bit later, but Spandana has advised me that I should go to the didactic, which is on project design, for about 10 or 12 minutes. Then the mentors, you are free to leave, and the mentees will stay on for an extra 15 minutes where we'll just cover some of the kind of administrative and practical aspects of things. So let me share my screen.
Megan, while you're screen sharing, once you finish the session, can we request the mentors to just wait for 30 seconds? We'd like to get a group picture taken, and then you can head out if you have to head out. Thank you.
Perfect. So we wanted to cover some key aspects of project design, and we know that some of these you've already covered, so I'm just going to highlight key points. It's going to be quite a high-level overview, but I think this will give you the key tools to move forward. So the key aspects related to project design, that after today's session, you'll be able to map stakeholders and develop SMART objectives. In fact, the good news is you've already done that by submitting the assignment that you guys already prepared. And then we're going to look a little bit in detail at the role and the value of a logic model to support your leadership project. And after today, you will actually develop that leadership project logic model for your project, which sounds very scary, but I can tell you that it's not so scary. So you already did this exercise, I just want to flag it, where you mapped your stakeholders and you looked at all these different key elements about them. So we'll see how that then fits into this idea of the logic model. You already framed your problem. You said, currently in our setting, this is a challenge because of this, and this affects and leads to this. So these are key steps that you have to do when you're starting to do a logic model. And you've thought already about SMART goals that are specific, measurable, achievable, relevant, and time-bound. So I just want to flag these things that you've already done. So then let's see how these fit together as part of a logic model. So what is a logic model? So basically, if you look in the management literature, it's this simplified way that you represent the theory of how your intervention, the project, the stuff you're going to do, is going to produce some outcomes, right? You have to actually think, if I'm going to deliver education, how is that actually going to lead to more palliative care being given to patients, right? You have to have that logic of what the inputs lead to as outputs. So you want to link together the resources, like the stuff you're putting in, the activities that you're doing, with your goals and your outcomes. You are going to also think about some other factors that are maybe external that could influence whether your project is successful and you get the outcomes you want. You think about short-term, medium-term, and long-term. And it really forces you to think, how is change going to occur? So I think this is an important thing that we go through so that we actually think through that process so we understand in our own minds, why is our project going to work? You can use it at many different. We're using it at the beginning. We're saying we're in this design and planning phase of the projects, right? But you can use it as you actually do the project because it tells you, what are you going to do? What are you going to implement and deliver as services or activities? And then you can also use it, we're not going to talk about this today, to evaluate and report on the project and what it did. So it's very useful along the whole way. And the nice thing is it fits all on one page. It's going to be a little bit busy, but you can kind of put it all together. I'm going to leave this video. It's a 2-minute video. I'm going to leave it for you to watch afterwards, given that my time is quite short. So this is what a logic model could look like. Okay, if you go online, every single management school has a slightly different version, okay? So this is just one that I selected, where you have a little bit about the situation, then you have the inputs. I'll explain what each of these things are, outputs and outcomes. Okay, and then at the bottom, you can see some things that are sometimes outside of your control. Like, what are the assumptions you're making? Like, that you can deliver the education. You have trainers to do the education if your project is education. And what are influencing factors? So what we're going to do is actually just look at all of these big boxes and what you would fill in for your project. Then at the end, we'll give you the worksheet and you'll have time to fill it in on your own in the next few weeks. So let's first think. I've told you some of the benefits, but I want to hear from you. What do you think are benefits of this logic model? Because if you don't see this as a benefit, you're not going to be very happy that we're giving you another worksheet after today's class. So what do you see as things that might help you by doing this exercise of creating a logic model for your project? Right away, I'm going to just stop sharing so people can raise their hand. You can put your answers in the chat as well. What are the benefits of a logic model?
Yes.
Yeah, go ahead. I didn't catch that.
If I may start,
Yeah,
Megan?
go ahead.
Based on the flow from situation to outcomes, I think if I'm going to go with outcomes, I think that would be the logic model allows us to be clear what we really want to achieve. And then from there, go backwards if we could look at it that way. So we basically have something very clear, a goal in mind, and that would allow us to do the steps on a initial and what would be the steps going to that goal. So at least it's not like just like I want to do something like this without even being very clear about it. So I think the logic model will allow us to be more detailed in terms of what we really want to achieve.
Great, thank you. So being clear about what you want so that you know how you're going to get it.
Similar to her, sorry to interrupt. Similar to her, it will also help us to accomplish the small picture at last, so we will be able to cover the bigger picture. The shift changes in the areas which we want. So,
thank you, Pragya. Yeah. Like get the small parts, get the details done so that you get to the big picture. Yeah. Okay, and people have put some great comments in the chat. Planning, appreciate assumptions, clearly define what you're trying to achieve, really as a framework. I love what you said, Mansi, the entire team gets on the same page. And beyond your team, you can use it to get your stakeholders on the same page, right? And then you really show that you know what you're doing, you know where you're going. Perfect. I don't mean to rush you, but we are going to move ahead. So here are some of the other benefits that we see in the literature. You've identified these. It's simple, it's visual, it's logical, like it just kind of lays out the whole thing for people. You talked about this. It explains what you're trying to achieve and how you're going to get there. Helps the team and your stakeholders have this shared understanding, gets you all on the same page, help you decide how to design your monitoring and evaluation, identify risks and assumptions. And you guys came up with lots of other great ideas, which I will add to this slide before we send them out. Okay, so then, sounds like it's great, but what's going to make it hard for you to do this? So let's think about that. What will be the challenges or drawbacks of a logic model? Or doesn't mean we're not going to do it, but what are the barriers?
the language barriers, information barrier, emotional dropout barriers, also the infrastructure hierarchy barriers. There are lots.
Great, thank you, Pragya.
Failing timeline, not fulfilling the timeline.
Yeah, you might not get there in time. Resistance to change, blind spots that might be hard to recognize. Infrastructure and funding, great. Yeah, so I think for everything, you're going to see how we do this, where we're going to say, okay, what are the benefits, but also what are the drawbacks, or what might make this fail, right? I often ask you the question, okay, if this is going to be, if in 2 years, you're going to look back and say, the Catalyst Lab was amazing, what has to be true for that to be happening? And then if in 2 years you look back and you say, I failed at my project, what might cause it to fail, right? So there's kind of that like looking back from the future and asking these questions. Some drawbacks that we see in management literature about logic models, they take some time to develop. So you have to figure it out. You have to map it all out. Sometimes you overuse them or you don't use them for the right purpose. Like you said, I think it was Pallavi said, if there are changes in your timelines, you need to update sometimes your logic model. And the real world is more complex than you could put on one paper and say, here's my logic model, right? So sometimes it doesn't match with all the complexities of reality. So here we go. Here's our logic model. Let's just take a couple minutes to look at the key steps and things that you're going to need to fill in as you prepare one. So at the beginning, you have the situation. So you're going to ask yourself this question. What is the problem that you're trying to solve? Remember, you've already done this. You made your problem statement. So you're trying to identify what's the cause, why do you need to do something? Who are the stakeholders? We'll talk a little bit about that. and what do you already know? And some of these things you might have already done. In the past, we've done SWOT analysis, looking at, a bit more the environment around your project. Again, I know I'm rushing a little bit. These are things that will give you some resources to read a bit more about. The next thing is the inputs. So there's two types of inputs. There are resources, which I've listed here. Could be things like time, planning, money, knowledge, materials, equipment, all the things you need to do the activities you want to do. But another input, oh, that disappeared, is the stakeholders, the people who are going to be involved. I don't know where it went. Maybe it's going to come up maybe the slide moved around a bit. And then you think about, once you've got your inputs, you think about your outputs. So you ask yourself the questions. What are we going to do? What are we going to create? Who are we going to involve? So sometimes you develop a list of activities. And here's different categories that your activities could be in. They could be like technical products, meaning documents. Like you could develop plans, you could develop reports, you could develop even networks, right? You could do training, you could deliver palliative care services, you can have meetings. Hopefully you have goals for the meetings, but sometimes having meetings is an activity, right? You can advise other people about things they should do. You can facilitate meetings or facilitate things happening, and you can disseminate things. So there's lots of different types of activities that might be outputs. And you'll think about these for your projects. And then participants. Who's going to be part of your outputs? You've got your stakeholders. You mapped them already, right? You might have some new stakeholders, people you haven't thought of, decision makers, and even what we often call in project planning service users, like the patients and families themselves. So you're going to think about, how are these people involved in doing what you're doing? So those are your outputs, and then you come to your outcomes. These can be short-term, medium-term, and long-term. Sometimes people go and call long-term outcomes impacts. Again, every place you look in management literature and in project design literature, you get like slightly different terms and slightly different logic models. So, just there's some variation in terms of what people think. So here we have the short-term outcomes that you might think about. So these are usually just changes in knowledge, skills, attitudes. You can have medium. Medium is where you actually change behavior or have people act different. You might change behavior. You might also do things like influence decision-making, right? You're trying to influence maybe policymakers, people who run hospitals or health services, and you might guide policymaking. These can be medium term. Of course, time can always stretch and they can be long-term as well. And then you can have long-term outcomes where things really change. So changes in condition or like the status of life. So then we're thinking more like the change in the health status of our patients. Their health is improved. For palliative care, we might say, okay, maybe it's their quality of life is improved because maybe their disease health can't improve, but we know that health is bigger than just disease. Sometimes your project might also improve cost effectiveness. That's a long-term outcome. It takes a long time for that to occur. You might get greater participation. Sometimes a project is about having a long-term outcome of having more people involved or having better community engagement. So think about these, because maybe you've thought, okay, my long-term outcome from our project is improving patients' quality of life. But are there other outcomes that you're going to see? Are you going to also engage with the community and actually get other outcomes that are valuable? I'll just highlight that sometimes it's tricky and people ask, okay, what's the difference between an output and an outcome? I'm not going to go over it today, but it's kind of outlined here for you to think about it. And then lastly, there's the idea of looking at assumptions. And that's what Sean mentioned in the chat as something that it can be helpful that your logic model can help you do. What's needed for this project to succeed? What haven't we thought about? Is there theory or evidence that supports the activities the way we want to do them and will help us achieve success? And along with assumptions, sometimes assumptions are separated from what we call influencing factors. What's the climate? That could mean the political, the cultural climate, the economics, the politics, the demographics that could affect our outcomes of our project. And again, this links back to your SWOT analysis that you've already done. I'm giving you this as an example. I'm not going to go over the whole thing today, but this VCFSE is just a health program that they developed. That was kind of a leadership group that they developed. So I like this one because it was very clear, a nice sort of example of a project and how they went through everything, the inputs, the outputs, assumptions and influencing factors, and then the outcomes. And I liked how they have the outcomes here at the patient level, the service or the organization level, and the system level, right? And I think for some of you, as you're thinking about your project, you could break it down like this. Another way to think of it is to think there are two sides to a logic model. There's kind of like the process side, which has your inputs. Sometimes inputs is divided, outputs is divided from activities, which you can see here. We've got inputs, activities, then outputs. That's, again, just another style of how people present a logic model. And then you have your outcomes, short-term, medium-term, and long-term. So again, just another way to think of it. Processes and then outcomes. Another way to think of it as you're creating your logic model is to use if-then statements that drive each step forward. So as an example, if you think about certain resources are needed to operate our program. If we have access to these resources, then we can use them to accomplish our planned activities. And then you list your activities. And then you could say, okay, if we accomplish our planned activities, then we will deliver, a certain amount of product or service. We will deliver education to 25 health professionals, et cetera. And you can move this forward. So again, this is be a helpful resource to check your logic model as you go forward. So we're going to give you this template that Archana will send around later in today, just as a worksheet that you can use to create your logic model. There are many online, as I've mentioned. So if this one doesn't suit your fancy, you feel free to Google online and find there are many, many other ones. They basically all have these same core components. But if you find something that sort of fits more with how you think about it, you're welcome to use that. And again, this one hasn't been divided into like that patient health system level that I showed you for that VCS one. So I'll stop there and hand over to Spandana just to before we dismiss the mentors. And my apologies for going a couple minutes over time.
Thanks, Megan. I just want to ask if the participants, scholars, and mentors have any questions for Megan. Okay, I think everyone is thinking about it in terms of projects. Thank you, Megan. I found it very, very interesting, especially at this phase when they're all working on their projects. I think it's a very good time to discuss about this and think about it in those terms. So thank you for that. I think Archana wants a picture of us all. I would like the mentors not to feel the pressure to stay after the picture, but if you stay, we are very, very happy to have you with us. Continue staying with us. So if you are able to come closer to the camera, smile a bit. Archana, probably you have to, because we are 36 people and it only
We have
covers
2 shots. Yes.
25 people.
Yes.
You
Okay.
have to do, yeah.
Now give me your widest smile and hold. Just a moment. Let me check that I've got it. Okay, I have one. We're taking the next screen. All right, 1, 2, 3, and smile and hold. Yes, I have both images. Thank you so much. Thanks. Over to you, Spandana.
Thank you, Archana. Thank you, everyone. I think what Megan was trying to say earlier during the orientation, it is on the scholar to initiate the interaction with the mentors. I think that is the one thing we want you to take away from today beyond the logic model is don't wait for the mentors to reach out. And this is done very, very explicitly so because we find it very difficult to ask help. I find it very difficult to ask help, and I have to train myself to do that. And when I do that and I receive help, it gives me a little more confidence that the universe is on my side to succeed. And we want you to have that kind of feeling that you initiate the conversation and you receive response instead of mentors trying to hound you and ask you for, oh, we haven't met in a long time. Should we meet now? We don't want that to happen. And as you can see, even in the tables that Archana has prepared, she has made a table for every month from now till the graduation. Doesn't mean you have to meet every month, but if you meet every month, that is fantastic. It could be a 30-minute meet, it could be a 45-minute meet. And for most of the meetings, we already gave a kind of outline if you don't know what to talk about. But if you have specific problems within the project, it's a good time to troubleshoot with your mentors. And it doesn't mean they're going to come and solve everything for you. But sometimes, again, when we talk to people, we find solutions that we haven't thought when we are working alone. So we get different viewpoints, but also when you're explaining the problem, the solution might arrive. So make sure that is one other thing that you use. During the whole 22 months, the next 22 months, we are not going to meet every month. We have taken some strategic breaks. And that is the time, just like you worked on your project sheet, we are going to work on them. Archana or Megan, if one of you can share the portfolio, we can just show them where all the asynchronous activities have to be pasted. And I think what Megan has said, we will send a logic model to you by tomorrow. And if you can go ahead and paste it here in section number 4, you all have received access to this document. You and your mentors have access to this document. This section 4, as you can see on the left side, you can paste every activity that you have finished. You can paste it over there. So at the end of 22 months, you can look back and you will see everything here. And even section 3, we have team reports. You don't have to worry about it now. This work starts in August 2026. So when you're having team meetings, when you meet together, when you're pitching to a stakeholder, make sure you take pictures of it, so that at the end of 22 months, you will have this wonderful collage of activities that you have documented, not just asynchronous activities, but also many pictures. Also, if you have published it anywhere, e-hospice articles or any such thing, it's good to bring it all here, right? And also, project is just a means for you to practice your leadership skills. We all want you to be successful in whatever you have picked, but the very act of the journey of trying to get it done and the skills that you will apply, this is the one we want you to take away from this place. So as you apply, as you reflect, please note down things here. You can say, oh, logic model helped us think, look at these gaps. And when you reflect upon it, after you finish Catalyst Lab, in the future, 5 years down the line, 10 years down the line, for a new project, you'll think back about logic model again, right? So in any other things, Megan, that they need to know?
Yeah, I think I want to just highlight a couple things. Hari has asked in the chat, can we mail the mentors personally between meetings? Yes, please do. That is absolutely something you should do. I also would highly recommend that you form a WhatsApp group with your mentors if they're agreeable to that. I think most will be, because this provides a way for just quick informal conversations, right? You know, it has a different role. If you have some major thing, it's better to send someone an email because then it's in their inbox. They can then respond to it when they have time. We all know the WhatsApp messages like disappear very quickly, right? You get 50 more and then you forgot that there was one way down there. So I think about what you should use email for and what you should use WhatsApp for. But I think those are both useful, and your mentor is expecting that they will spend time each month responding to those things. Of course, they are not available 24/7. They all live in different time zones. So, just think about those things when you're sending things. And they are not here to solve all your problems. They are more, like Spandana said, a sounding board, right? They will reflect back and be like, They will ask you questions, they bring their knowledge, they've solved lots of these kinds of problems before, but ultimately they, as leaders, know that the only person who can solve your problems is probably you, right? But they will give you their insights about how you might think about doing that. I wanted to just show you a couple more things that build on that. And again, we are going to send all the slides because I know there's like a volume of information that we have shared. So the three key things we've covered from a programmatic or admin point of view today is the project portfolio. We've talked about the mentorship. I just want to talk about expectations in terms of attendance, dates, deadlines. Okay, because we like to lay this out at the very beginning so that we don't have any surprises in the middle. Okay, so I'll put it in. We expect that you attend all the online sessions. Yes, they are recorded, but it's not useful. It's not about just listening, right? We have asked all of our speakers to have some level of interactivity. So they're not just going to come and give a lecture. We are really asking them to give you something ahead of time to look at, like you did today, right? Today, ahead of time, we had the SWOT and the stakeholder mapping and forming your problem statement and your SMART goals, because that's way more interesting if you do it for yourself than for me to tell you how to do it, right? These are not the most complicated concepts, but you just need to work through each of them. So each of the sessions will be like that online. So we are expecting you to attend all of them. If you are not able to attend, please just send Archana a short message. Of course, we know life happens. Sometimes you're on an airplane unexpectedly, or you have a baby, your wife has a baby. Like, there are, of course, some flexibility, but we are expecting participation in all sessions and that active participation. And then, of course, I think it goes without saying, but please work collaboratively with this wonderful group, this team that you've formed now, that you've all introduced yourself. Work with your team to develop and implement your project. Again, we know that life changes. You know, in the past 2 years of running this leadership program, there were 2 countries where there was major upheavals in the governments during the time that people were trying to do their projects. And as Spandana said, the leadership project is a way for you to develop leadership skills, right? So you will develop skills even if there are major changes in your project. So major changes can and do happen. But the point is that when they happen, you adapt your project. You don't just disappear, right? You say, okay, there was a revolution. I can no longer go train at those hospitals where I wanted to give them training. I'm going to have to be a leader. I'm going to change my project to something else that is possible given the new situation that my country, my city, my life is in. Okay. We have shared with you all the dates, but I just want to highlight how there's a sort of cadence to it. So we have 3 sessions. Usually there's 3 or 4 sessions, and then there's a break where we have asynchronous activities. We have done this on purpose so that it's not too busy for you, because we know you are doing many other things. So that's, again, why we're really asking you, when there are sessions, don't miss them, because there's not that many sessions, okay? There will be specific instructions for those asynchronous activities, what you need to do and submit in the times when those are allocated. So again, 3 sessions, September, October, November, and then there's 2 months for asynchronous activities. Same thing, 3 sessions, March, April, May next year, and then the asynchronous for 3 months. And then finally 3 last sessions. And then there's a session, it's a little different. There's project report backs, asynchronous session. And then I know it's a long time for now, but try to put it in your calendar that in February 2028, we will be meeting in India, wherever probably in Hyderabad or in the location of the Indian Palliative Care Conference that year. We haven't quite said it yet, but we will have it. Our goal is to have an in-person session workshop at the end then. We've talked about the project portfolio. That was the only other thing I wanted to mention. So I think those were just the key last points to cover. And I do acknowledge we've given a lot of information. So we're happy for any clarifying questions, comments, but we are trying to really streamline everything. So you will get reminders, you will get updates, okay, keep filling out your portfolio, etc. But we're trying to use that portfolio document for almost everything. So you just have that one place where you're keeping all your documents, everything.
I'd like to just add to what Megan said. One or two of you had messaged me personally asking, if you make edits on the project portfolio documents, can your other team members or your mentors see it? Yes, it has been shared with your group. So it's a working document. So as in what you're working, everybody has access to the file. And also you will see there are recurring meeting links that are given to each group. So when you want to meet with your mentor, you can use that meeting link and start your session. Yeah, so you don't have to worry about not having access to a paid Zoom version if you don't have that. Yeah, those are the two things at this point. Yeah.
Megan, I was wondering, Dan is still here and he played quite a bit of role in designing the mentor-mentee interactions. If Dan has anything to add. Dan, are you still here? Yeah.
I am. I'm in the car. I apologize.
Oh.
But what I would say is, I mean, just a few things. I think that you just to echo everything you guys are saying. Absolutely, we are here to help support you. We're here to empower you, and a big part of what we're hoping we all learn together is, as you guys shared, is how to lead. So the project is, of course, incredibly important, but as important is how we approach it as leaders, how we pivot, how we change when we need to, how we adjust when we need to, how we stay on target, as how we see, as Megan talked about, how we start with the end as we begin and help connect what we're hoping to accomplish. And until we really have that drilled down to exactly what we're hoping will be different when we're finished, it's often a little challenging to stay on course throughout. So please keep that in mind as you go forward. And we're just delighted to work with you and really excited to be a part of these incredible projects. Thank you.
Megan, you're muted. Megan, sorry.
It's the best way. Any other faculty, any comments or anything we missed? As you know, this is the first time we're running this particular version of the leadership program. So we're always, making sure we catch everything. Great. Okay. Well, we've kept you 6 minutes over time. That's mainly because whenever I'm the speaker, things tend to go a little bit longer than they should. My apologies. But we'll try and generally the sessions should be 1 hour going forward from here, just so you know, so you can plan for your time away from the rest of your lives. So thank you, everyone. Have a wonderful rest of your day. And we're so excited to be with you. And I think what we can do, Archana, is you can paste the logic model into their portfolio asynchronous section so they can just fill it out there.
Absolutely.
Right. Again.
So you will have access to that tomorrow. The recording and other resources also should be available by tomorrow latest. Yeah. I've shared the session feedback link. Please take the time out to do that. I will also share it in the WhatsApp group. So if you have to drop off, I think we're okay for that. But help us understand how we can improve and deliver the project better. So take 2-3 minutes to share your feedback.
Thank you, everyone.